ATNEC is a large breast cancer study that is currently being undertaken in the UK. When breast cancer has spread to the armpit lymph glands, surgery to remove all the lymph glands in the armpit is usually performed for the patient. But this can have side effects such as arm swelling, which can be long-term. Many patients these days receive chemotherapy before surgery to shrink the cancer. Chemotherapy treats the whole body and can get rid of the cancer that has spread to the armpit lymph glands in more than 50% patients. We are investigating in this study whether surgery to remove all the lymph glands in the armpit and therefore the side effects can be avoided in patients who do not have any residual cancer in the lymph glands after chemotherapy. This video is an example doctor-patient consultation discussing ATNEC study for the first time. The scenario is that Mrs. Smith has been found to have lump in the right breast. She's seeing the doctor today to discuss the results of the biopsy and further management. Hello, Mrs. Smith.
Hi.
My name is Amit Goyal, consultant surgeon, and Jackie Conway is our breast care nurse.
Hello.
We are here today to discuss the results of the biopsy that you had during your last visit.
Yes.
Is that correct?
Yes, that's true.
So just to recap what we did last time. So if you have a look. You visited the clinic 10 days ago.
Yeah.
And we found a lump in the right breast. You had a mammogram, an ultrasound scan, and you had some biopsy as well.
Yes.
We did a biopsy from the lump in the breast, and on ultrasound scan, they found a swollen lymph gland in the right armpit, and we've taken a bit of tissue from the lymph gland as well for testing.
That's right.
We have the test results now, both the test results, and I'm afraid the biopsy from the breast shows breast cancer, but this is treatable. It is a small cancer, and it's all treatable.
I kind of expected that. How treatable is it?
We can treat this, and most women in this situation with the right treatment can be cured and lead a healthy long life. The needle test from the lymph gland is back as well, and that, I'm afraid, shows cancer spread to the lymph gland as well. But that's still treatable as well. It doesn't mean that just because the cancer has gone to the lymph gland, it doesn't mean it's not treatable. That's treatable as well.
Fine.
Remember what Mr. Goyal said, that this is treatable,
Yeah.
and it's good that we know about it.
Yes. It's better.
We do some special tests on the cancer, on the biopsy, so that we can plan what's the best treatment way forwards for you.
Okay.
And the cancer, some of the special tests are estrogen receptor, which is a female hormone in the body. So we check whether the cancer is hormone dependent or not. In your case, the estrogen receptor is negative. The progesterone receptor, again, progesterone is a female hormone in the body, and that's come back as negative as well. So which means that the cancer is not hormone dependent. And we do an additional test, which is called HER2 or HER2, and that's positive. What that means is that this kind of cancer responds very well to chemotherapy and a targeted drug called trastuzumab or Herceptin.
What's the difference between hormone and chemotherapy?
Yeah. So if the cancer was estrogen receptor positive or progesterone receptor positive, that means it's feeding on those female hormones in the body. And then we have tablets these days which can counter these female hormones. So to stop the risk of cancer coming back in the future. But in your case, because the cancer is not hormone dependent, you will not benefit from these tablets.
Okay, so chemotherapy then.
Chemotherapy, because these kinds of cancer respond very well to chemotherapy, we tend to give the chemotherapy before surgery.
Okay, so no surgery right away.
Not straight away, but we'll refer you to the oncologist first, who will discuss chemotherapy with you and put plans in place for you. The chemotherapy often lasts for 4 to 6 months, and then after that, they will refer you back for surgery. And these days, in this kind of cancer, the chemotherapy often works very well, and it can actually shrink the cancer, or even the cancer can completely disappear, even in the breast and the lymph glands.
Even if you had chemotherapy after, if you had surgery first, we know you'd still need chemotherapy. So sometimes they do the surgery first and then the chemotherapy. But what we know is with all the information, what Mr. Goyal said, is from all the information we've got at the moment, we believe that this would be a better way, and it would be, your cancer would respond to it. Okay, so it's still a treatment. So I don't want you to think that by not having surgery, we're not removing it. We will be doing that, but we're going to give the chemotherapy first, and that will treat the whole body.
Right.
Okay, so that will treat the breast cancer.
When does the chemo start usually?
Yeah, so it will take a few weeks, because first we'll arrange a consultation with the oncologists who are experts in this, who will discuss this in a bit more detail. We'll give you a chemotherapy booklet today to go home and read about it as well.
Okay.
After you finish chemotherapy, the oncologist will refer you back to me and we'll discuss surgery. Now, the standard treatment in these situations, when we know that the lymph gland has cancer as well, when you come back after finishing chemotherapy, we normally would have taken all the lymph glands out at the time of breast surgery, which could be a lumpectomy or mastectomy. But in your case, because the cancer is small in the breast, and the chemotherapy would shrink it further, most likely, so you can have a lumpectomy. But to the lymph glands, the standard treatment is that we take all the lymph glands out. But we have a study now, which we are running, called the ATNEC study, ATNEC. If you take part in this study, what we are trying to do is, after you finish chemotherapy, we won't take all the lymph glands out, because many times the chemotherapy has killed all the cancer in the lymph glands. So cutting normal or healthy lymph glands out cannot be expected to be of any benefit to you, but can give you all the side effects like arm swelling, shoulder problems, sensory changes, numbness, which can last a lifetime. So if you take part in the study, what we'll do is, we'll mark the lymph gland with cancer before you're sent to the oncologist or during the first few cycles of chemotherapy. And then you have your chemotherapy. After finishing it, we'll see you in the clinic and put a plan in place for surgery where we'll take only the marked lymph gland, which has cancer in it today, to check if the chemotherapy has worked or not. And plus we'll take 2 or 3 more lymph glands around it. So in total, the surgeon will take at least 3 lymph glands from your armpit to check how the chemotherapy has worked.
What do you use when you said marking? How do you know? How do you mark them?
Yeah, there are various ways we can do it. At our hospital, we routinely use a black dye to tattoo the lymph gland, so that at the time of surgery, once you finish chemotherapy, the surgeon can actually see the black node. But in addition to the black dye, the surgeon will also be doing a procedure called sentinel node biopsy, where they'll be injecting a blue dye and radioisotope as well to find the first few lymph glands and take them out as well, along with the marked node. So if the 3 or 4 lymph glands the surgeon has taken out, they come back as all clear of cancer and there is no more cancer in that, then there is no benefit in cutting all the lymph glands out. So then, because you're part of this study, you'll either get radiotherapy to your armpit or no radiotherapy to the armpit. But either way, there's less risk of arm swelling. We know from studies that if you give radiotherapy to the armpit, rather than cutting all the lymph glands out, the risk of arm swelling is almost half. So either way, you are at less risk of arm swelling or lymphedema.
You don't need to decide today, okay, because you've had a lot of information, so you have got some time to think about it, okay?
What if I decided I don't want to be part
That's
of
fine.
the study?
That's fine, yeah.
Then
There's no pressure. We will support you either way. So if you decided you didn't want to go in the trial, what we would do is when we did the surgery to the breast, we'd remove all the lymph nodes.
okay, let's say I agree to be part of the study. What are the chances of the cancer coming back in the armpits?
Yeah, so you won't be undertreated. Because if the 3 or 4 lymph glands the surgeon has taken out, they show that there is cancer still there and the chemotherapy has not killed it all in the lymph glands, then we'll still offer you standard treatment to the armpit, which is cutting out all the lymph glands.
So if there are still cancer cells in my armpit after this smaller procedure, then I'll go for the bigger one.
Yeah, and then it would make sense to take all the lymph glands out
Yes.
because we know that the chemotherapy has not worked the way that we had hoped it would work. But you'll still get any other treatment, for example, radiotherapy to the breast as normal.
And you mentioned radiotherapy to my armpit?
Yeah, so if you take part in the study, if the 3 or 4 lymph glands we take out after you finish chemotherapy, they are clear of cancer, then the computer will randomly allocate you to either get radiotherapy to your armpit or not.
And what's the difference between getting radiotherapy and not getting radiotherapy?
Yeah.
Is it part of the study?
It's part of the study
Okay.
because we're trying to find out if any treatment to the armpit is beneficial to patients if the chemotherapy has killed all the cancer in the first place. So this will help us to compare the 2 patient groups in the future. And there is no rush, as Jackie said, because you have enough time to consider the study, and the research nurse will be in touch with you even during your chemotherapy. She can talk to you when you come for the chemotherapy cycles. So there's enough time for you to consider, because initially, as Jackie said, there's a lot of information to take in. So she can get in touch with you later on, maybe during a 4th or 5th cycle as well. And so that as long as a decision is reached either way, before your surgery, after chemotherapy, that'll be okay.
What if I decided in the middle of chemotherapy that I don't want to be part of the study after agreeing? Is that fine?
That's fine. That's fine.
Okay.
Yeah.
I'm going to give you some information today to take away anyway, and I'll make sure you've got some information regarding the trial, and also I'll give you the number for the research nurses, okay, and they'll be in touch with you, okay. Mr. Goyal will be doing a letter, so we'll put all that in a letter to you as well, so you'll have that as well. But there's no pressure to do one or the other. You do what's right for you.
It sounds like less, which is still a lot to think about.
There's a lot to think about.
Yeah.
So what we'll do now is, do you have any further questions?
If I wanted to keep my breast, will this affect anything later in the treatment? Like, can I keep my breast later?
Yeah, sure. So because the cancer is small and the chemotherapy is likely to shrink it further, so there's no reason to believe that you won't have a choice after you finish chemotherapy if you want to keep your breast and have a lumpectomy or breast conserving surgery. I think that should be perfectly feasible for you.
Does that affect the trial
No,
in
not
any
at
way?
all. No. Yeah, so your decision whether to save the breast or not does not affect your participation in the study or your decision towards that.
Okay. We'll think about it then.
Okay. So what we'll do now is Jackie will take you to a quiet room where she'll give you all the written information and you'll have a chance to talk to her as well.
Thank you very much.
Okay.